Avik Roy is a senior fellow at the Manhattan Institute, National Review columnist, and author of How Medicaid Fails the Poor. This is unbelievable. I mean, this is from the Reuters report an hour ago. Health plans will estimate how much they're owed, and then they'll submit that estimate to the government. Once the system is built, the government and insurers can reconcile the payments made with the plan data to true up the payments. Oh, joy. So it's basically an honor system, if I'm reading this correctly.
Well, the basic thing to understand is it's not a bailout of the insurers, it's a bailout of the president. Because 2 weeks ago, we heard from one of the top IT officials in the administration that the systems to pay the insurers hadn't even been built yet.
Right.
This was 2 weeks ago.
30 to 40% of Healthcare.gov, he said, has not yet been built. And we talked at the time about, well, okay, what part exactly is that? And they revealed it was the payment mechanism.
Yeah.
So now for weeks, people have been saying, well, how are the insurers going to get paid? And this is the solution, Avik?
This is the solution.
We're going to trust the insurance companies to say, I think you owe me X million in subsidies for the following people who have submitted for coverage. Is that basically how it's going to work now? Basically,
because what's the alternative? The alternative is if the insurers don't get paid that way, then the insurers will hemorrhage money trying to cover all these people, and they'll withdraw from the market.
They're not going to do it.
So the Obama administration is saying, well, the only way we can keep the insurers participating in this market is to pay them in advance and trust them.
If the person successfully enrolled through Healthcare.gov and there had been a payment mechanism portion of the website, that portion would have had what on there? People would have had to enter financial data. I mean, is this the portion of the website that calculates how much of a subsidy they're going to get and then tells the feds, okay, cut that amount of a check to Aetna?
It's the simple system of when the individual signs up, and that he signs up for a particular plan, he has to actually pay the insurer for whatever the subsidies don't cover. And the insurer can't get paid for that because that system hasn't been built. So the insurer, you aren't officially enrolled if you haven't paid the insurer. Technically, enrollment doesn't happen unless the insurer has gotten a check from you. And so you may go to the doctor, think that you've signed up on Healthcare.gov. The doctor says, you're not insured. I don't have an insurance policy for you. And that's when the people say, well, I've just consumed all these services.
But now let me ask you, because I think you might be conflating two issues. You're the expert, not me. But there are two issues, at least tonight, with this system. Number one is reports today are everywhere that up to 30% of the people who have enrolled on Healthcare.gov only think they've enrolled. And that, in fact, the enrollment has failed, and that when they go to their doctors on January 1st trying to get coverage, they're going to find out the hard way that their attempted enrollment failed and they don't actually have coverage. But problem number two is 30 to 40% of their website is not yet built, and it's the portion that accepts payment. And this announcement tonight relates to issue number two. They're trying to get a way to improve the payment situation, and according to this Reuters report, they are meaning to cover the subsidies and premiums that the insurance companies are waiting for.
So as you say, there's two issues. In the private sector, in the private health insurance market, the way it works is you're not officially enrolled in a health plan until you've sent a check to the insurer has received payment, then you are enrolled. So what the administration is calling enrollment isn't really enrollment. They're just saying you've been signed up correctly for the plan. But you can be signed up correctly for a plan, which is the 2/3 you're talking about, and still not have paid the check to actually be officially enrolled.
Right.
So that's the problem. The payment is what creates the enrollment. Signing up for a plan but not paying does not count as enrollment.
And so the solution tonight, because you cannot pay right now, is they're just going to, the feds, Uncle Sam and the insurance companies are going to sit down together. The insurance companies are going to say, trust me, this is how much you need to give me. And for this amount, I will cover the following people. And then later they're going to true it up, Avik. Do we have reason to believe, I mean, with all due respect to the health insurance companies, have you ever dealt with a health insurance company? I mean, do we have reason to believe that we can just trust their word and that later, if we, the taxpayers, paid them too much, they're going to give us a big refund?
In this case, we have more reason to trust the insurers than the Obama administration, because if the insurers are dishonest, everyone's going to get mad at them. And they're already so politically under the gun that they're just trying to keep their heads down and not get shot.
But do you have any idea of the waste, fraud, and abuse that's in this system already? And
Absolutely.
Now, instead of having an actual system that will calculate the payment and make sure that the T's are crossed and the I's are dotted, we're going basically on an honor system where the insurers are going to tell them, this is how much of the American taxpayers' money I want, and we're going to start cutting checks.
The real area where the waste, fraud, and abuse is an issue is in the size of the subsidies, because that's where the true honor system is. There was a report issued today by the auditor of the IRS that says that the IRS doesn't have the systems to check what your income is, to see what subsidies you're eligible for, and that's going to incentivize a lot of Americans to game the system and say, you know what, I actually didn't make that much money this year, therefore give me a bigger subsidy, a bigger check. That's where the fraud is, and that's where the real problem is.
My head is swimming with the amount of issues that we've just ticked off just in this one segment. Avik, thank you for being here.